My path to Vision for Life ultimately first went through academia. And I was at Vanderbilt University for about 8 years as their, in essence, lead cataract surgeon. I also did LASIK and corneal transplants. And that's when the new implants were starting to be worked on, and I started to research those implants in FDA clinical trials. And I became very intrigued by what the future was going to hold for people who were having their cataracts removed, and how we were going to go from cataract surgery to lens replacement, which is what I like to call it, because cataract surgery is kind of a misnomer. It's like calling knee replacement arthritis surgery. So after about 8 years at Vanderbilt, I left there and I founded Vision for Life. And Vision for Life is based upon several guiding principles. One is that we are going to use the most advanced technology available to correct vision. Vision for life, vision for lifestyles. It means many different things. There's so many different things, and I decided that my job, until my career was over, was now going to be to see how I could best correct vision. I bet upon the notion that if patients knew that there were options available to them, that they would likely choose those options in order to improve how they saw. It's also founded upon guiding principles of what it means to be a doctor. That these are patients that are coming in to see us, that are scared, they're anxious, they don't know why their vision is changing, they're afraid of having any surgical procedure. And I went back to my time as a kid and saw my mom in that hospital, and I tried to be the doctor to people I don't know, but I like to get to know. And I try to be the doctor to them that I wanted doctors to be to my family. Those are the guiding principles of Vision for Life. Each patient matters, their experience matters. We don't want to have them come in and make them feel like they got to spend 3 minutes with the doctor, even though that's the way healthcare is going. I'm trying to buck that trend as best as I can. I'm trying to provide the care that you would want yourself, that you would want for your family. I'm trying to provide the care that I want for my family.